Good day and welcome to our webinar on anticipatory grief. We are very fortunate to have Cynthia Oxman, who is a retired social worker with many years of experience in palliative care. She's going to talk to us today about anticipatory grief, what is it, and some strategies for coping.
Thank you, Brenda, and hello, everyone. Thank you for being present at this webinar. So anticipatory grief, as Brenda said, we're going to talk about what it is, what are some symptoms or feelings that are associated with anticipatory grief, and I'll give you some strategies for coping and managing. So let's look at what is anticipatory grief. Anticipatory grief is the feelings of grief or loss that occur before an actual loss, that normally occurs as the result of learning about a loved one's serious and life-limiting diagnosis and a poor prognosis. It can be exacerbated by a number of things, including watching your loved one suffer, particularly when they suffer a severe decline in their physical or cognitive functioning, as well as a number of other issues that we'll talk about today. Anticipatory grief happens before the loss occurs, and it enables individuals to prepare emotionally for the death of their loved one. Or that's often how it is perceived as being a functional thing. So what are the symptoms of anticipatory grief? Symptoms can include feelings of disbelief and shock, sadness and depression. It may cause you to feel angry at yourself or your loved one, and frequently at the healthcare system who won't be able to cure your loved one. Anxiety can occur, anxiety about the future, about what your loved one's illness will look like, or that is, will they suffer? Are you making the right decisions? Financial anxiety is very common, particularly when you experience significant income changes due to changes in the employment status of your loved one, as well as sometimes your own if you're required to take some time off from work to care for your loved one. Frequently, people report feeling a lack of patience with people who aren't able to answer your questions, or when people approach you with unhelpful or unsolicited advice or suggestions. Sometimes even if others, just because you're exhausted from worries and caring for your loved one, you just feel irritated when anybody approaches you. You may experience a sense that your loved one is already gone, particularly in the case of cognitive changes that can occur. People report sometimes wishing that this whole thing were over, which is different than wishing that your loved one will die or has died. You may feel a sense of numbness that you might interpret as having nothing else to give or just not caring enough. Sadly, while this numbness is related to shock and a sense of helplessness, you may interpret it as not caring enough or having nothing else to give. This interpretation can cause feelings of guilt and can exacerbate depression and anxiety. So what impact do all of these feelings and symptoms have? So while these emotions do help you to prepare for the psychological impact of an actual loss, many people report feelings of guilt for grieving for someone who they love, who is still living. They feel anger about the illness, worry about the future and how you will cope without your loved one. And this may cause you to react in ways that are alien to you. You may start snapping at others and lose patience with what you now perceive as frivolous requests. You may experience anger and frustration with people who offer up unsolicited and unhelpful advice, as I mentioned. And you may even feel that desire for death to occur, especially when your loved one appears to be suffering. And that's because it's so painful to watch your loved one suffer. It's not because you want them to die. When a loved one is unable to assume their normal role in your family systems, that loss is real, and you are already experiencing a loss. Other losses you may experience include financial losses, I mentioned, due to employment changes, loss of roles, loss of changes in family roles, which is another loss, particularly when, in some cases, the ill person has always been the primary caregiver, the person to problem solver, the person to always be there when the other person felt vulnerable. And now things are reversed and that relationship is reversed. Many people report when if one spouse is the primary financial money manager in the family, and then that role has to change, and now the person who does not have the illness becomes the money manager, that can become very difficult and particularly overwhelming if you just don't have that experience in doing it. So the role changes are already a loss, but we include them in our discussion of anticipatory loss because it does contribute to that anxiety and that sense of worry and distress. So what is important to remember is that these feelings are common, they're very normal, but they can be strong and overwhelming, and they can affect your own physical and mental well-being. So what I want to talk about next are some strategies that many people have found helpful to manage through that anticipatory grief that they're experiencing. I can't stress enough that it's so important to recognize these feelings as normal. They do not mean that you have stopped loving the person who is ill when you have that desire and that just feeling like, why can't this stop? Finding someone you can talk to about these feelings will help. Perhaps a close friend or a family member who may also be experiencing anticipatory grief, or a social worker at the hospital if your loved one happens to be in hospital, or a counselor. Sometimes if you have a close relationship with your pastor or chaplain or minister, they can be very helpful as well. It's also very important that you take care of your own health by keeping a proper diet and taking some time out for exercise. It's important to stay hydrated, particularly if you're spending a lot of time in hospitals, which have extremely dry environments. Ask for help. A social worker may be able to help you with some of those anxieties around financial distress or just overall what you're experiencing, because they can help you with referrals to resources. They can help you organize home care if appropriate, or sources of financial aid. They can help you do a financial assessment and maybe offer up some suggestions of resources that can help. They may have some knowledge of childcare resources if you have young ones and childcare becomes an issue. Often social workers can refer you to support groups that can be helpful. It's important to identify what might be helpful when friends and families make offers of assistance. Many people don't know how to react to someone who is experiencing distress. So when they say, "How can I help?" they usually mean it. Sadly, many people don't know that it might be helpful for them to offer up suggestions of what might be helpful. But when they ask for assistance, think about what would be helpful. For example, you might need some help with meal preparation if you have other family members or young children at home. Ask them to visit your loved ones so that you can take that time for respite for yourself, so that you can take a walk or look after your own needs or go to an appointment that you need to attend. If it just means sometimes just getting out and getting some fresh air while someone else sits with your loved one, take advantage of that and ask for that help. Most importantly, I ask that you be kind to yourself and don't judge your feelings. Just acknowledge them for what they are without guilt or judgment. They're normal, and there's nothing wrong with you for having these feelings. I want to talk a little bit about sleep strategies because we talked about the importance of diet, exercise, and I mentioned sleep disturbances are often one of the symptoms. Some sleep strategies that are often in the literature. I found some of these through the literature, some of these that I've found helpful myself and that other people have found helpful or suggested to me when I was experiencing sleep disturbances. Develop a consistent bedtime routine. Reduce caffeine intake and try to avoid too much liquid intake just before bed to avoid sleep disruptions. Meditation and deep breathing exercises can be helpful and help you lull you into a sleep. Avoid active exercises too close to bedtime. The literature that I looked at suggested to sort of slow down and wind down about 2 to 5 hours before bedtime. Avoid eating before bedtime. Give your body time to digest. And again, I'm not a science person, but what I read in the literature is they suggest 4 to 5 hours of digestion time after, particularly if you eat a big meal at dinner. Avoid sugar and alcohol before bedtime. Again, probably 4 to 5 hours before. And try reading or watching something that feels relaxing. Audiobooks can be very helpful and as I say, lull you to sleep, or turn on a podcast on something that's relaxing or enjoyable. Maybe a travel podcast if you like travel, or book studies, but something that isn't going to hyperactivate your brain. I wouldn't put on politics, for example, or something too stimulating or shocking. Keep your room dark. Sometimes it's helpful if you use your phone as an alarm, turn over your phone so the light doesn't shine from it, or dim the light on it at least. Or if you have an alarm clock that lights up at night, turn it around so that it doesn't face you, can be helpful. So basically that concludes our presentation, but I just want to summarize by saying, I just want to summarize the most salient points. And as I mentioned before, and remember this, most people who witness a severe decline in their loved one's physical or cognitive health experience anticipatory grief and the sometimes overwhelming feelings and symptoms associated with. It's very normal. I'd like you to recognize that these feelings are normal and should never be judged or suppressed. And with that, remember that acknowledging the feelings for what they are, taking care of your own physical and mental health needs are the best ways to manage and cope with your feelings. Finally, I'll conclude with this. Watching a loved one suffer causes suffering, and you deserve to be cared for as well. So please be kind to yourself, reach out for help, and you will find someone there. Thank you for your time. And Brenda and I have discussed about how to facilitate answers to any questions you might have. And Brenda, if you don't mind, I'll let you take that one on, please. Thank you again.
Thank you very much for attending this webinar. We have contact information if you need to ask any questions. Thank you, Cindy. The strategies you mentioned, they will be very helpful to people as they deal with their anticipatory grief. And I liked your comment about being specific with the kind of offer that you want to give somebody or take from somebody. So like walking the dog, making the supper, sitting with a loved one. Excellent advice. Thank you so much.
Thank you, Brenda.